So I want to begin today by thanking those of you who continue to practice social distancing across the state. It may not seem like it now, but you are helping us to get to the end and eventually get to returning to our regular normal. To those that continue to be outside disregarding social distancing guidelines, I'm begging you to think of your fellow man, woman, and child. The interconnectedness between all of us is so clear, and we need our entire community to perform these important tasks, or else we suffer the consequences for all. Today, unfortunately, we are sharing 673 new cases of COVID-19, which brings our total for Illinois to 2,538 individuals. Sadly, this also includes 7 additional deaths, which brings us to 26 lives that have been lost to COVID-19. 37 counties across the state are reporting cases. Even if you happen to live in a county that does not have a case right now, you should absolutely take precautions and follow all of the same guidance as if you knew the virus was circulating in your community, because it is. Please take the same precautions and stay home as much as possible. I urge us all to not become complacent. It's the only way we're going to end this pandemic. Let's actively work together for the betterment of all. I know that as the weather warms up, we are tempted to get together and socialize, but we need to look forward and look for the big picture. There's a lot at stake, and we can't go for short-term wins at the cost of our society. Let us not grow weary in well-doing. Let's stay strong and stay the course. It's the only way we can stop the spread of COVID-19. We have to reduce the number of people who get ill. We have to reduce the number of deaths. We can end this pandemic. And now I will summarize my comments in Spanish. Buenos tardes. Me llamo Ngozi Ezike y soy la directora del Departamento de Salud Pública aquí en Illinois. Quiero comenzar hoy diciendo gracias a la gente que continúan practicando el distanciamiento social en todo el estado. Ahora no parece, pero está ayudando a acercar al normal. A los que continúan afuera, no practicando distanciamiento social, les pido que piensen en sus compatriotas de Illinois. Los está poniendo a usted y, lo más importante, a usted mismo en riesgo. Hoy reportamos 673 nuevos casos de COVID-19 aquí en Illinois. Esto incluye 7 muertos adicionales que nos lleva a 26 vidas perdidas en Illinois. 37 condados en Illinois están reportando casos. Si no hay casos reportados en su condado, todavía debes tomar precauciones, como si el virus estuviera circulando en su comunidad. Probablemente el virus está. Tome las mismas precauciones y quédase en casa tanto como sea posible. No seas complaciente. Es la única forma en que vamos a terminar con esta pandemia. Tenemos que cuidar uno al otro. Yo sé que el clima se calentará. Podemos sentir la tentación de reunirnos y juntarnos. Les pido que no lo hagan. Vamos a seguir luchando para Illinois. Es la única forma en que podemos detener la transmisión de COVID-19, reducir la cantidad de personas que se enferman y poner fin a esta pandemia. Juntos lo haremos. And with that, I would like to bring back to the podium Governor Pritzker.
Thank you, Doctor. Thank you to Dr. Ezike. Earlier today, we received word that my request to the President for a federal major disaster declaration for Illinois has been approved. This declaration will provide emergency funding to increase hospital and housing capacity as we respond to this unprecedented health crisis. This declaration also provides resources to expand telehealth, allowing us to safely reach more Illinoisans in need of care. My administration is also seeking another disaster declaration for all 102 counties of Illinois, which would allow us to access FEMA's Individual Assistance Program. This would give us resources like more unemployment benefits for those not currently eligible for state unemployment insurance, enhanced benefits for those seeking shelter, food, and emergency supplies, new legal services, and financial assistance to our underinsured households. I want to begin today by reiterating yet again how vital it is to follow the guidelines of our stay-at-home order. First, let me say that the vast majority of you have been doing exactly what I've asked and what the doctors have recommended. So thank you. You're staying at home and you're following the CDC and IDPH guidelines for staying healthy in the midst of this pandemic. But yesterday, when temperatures across Illinois went above 50 degrees, in Chicago that meant that people were breaking out shorts and heading to the lakefront, and that happened in other places across the state as well. Throwing all caution to the wind in the midst of a deadly pandemic is not acceptable. You are putting not just yourself, but your family and your friends in danger. You're also putting strangers in danger as you come in contact with them. Sometimes it'll be a parent or a child, someone you don't know, someone's spouse or loved one. Folks, we live in a free country, and we all want to maintain our freedoms, even in the context of our stay-at-home order. But I am begging you, please, if you don't have to be out, stay inside. If you go outside, please find a place to go that is not crowded. For the sake of everyone's health, follow the social distancing guidelines that we talk about here every single day. Stay 6 feet apart and don't gather in groups of 10 or more. Right now, hosting a party, crowding down by the lake, playing a pickup basketball game in a public park. If you're doing these things, you are spitting in the face of the doctors and nurses and first responders who are risking everything so that you can survive. We are quite literally in the middle of a battle to save your life. Every day I look at the number of positive cases, of tests conducted, of deaths. I pore over hospital capacity and bed utilization and availability of ventilators and stocking of PPE and increasing the number of makeshift ICU beds around the state. My staff and I work to chase down literally every lead for personal protective equipment. And your public workers are engaged in this activity every single day, all across our state. Right this moment, emergency workers are delivering new containers of nearly 1 million units of personal protective equipment like masks and gloves to healthcare workers in Edwardsville, in Champaign, and in Peoria. And every day I ask myself, what other measures can I take to halt the spread of this virus? To be very clear, this virus doesn't care that you're bored and that you want to hang out with your friends. It doesn't care that you don't believe that it's dangerous. The virus could care less if you think that I'm overreacting. It has infected infants. It has killed people in their 20s and 30s and 40s. It has forced doctors around the world to make terrible decisions about who will live and who will die. If you get a loved one sick because you didn't stay inside, they will have to travel alone to the hospital without you by their side to comfort them and look after them, because hospitals and healthcare centers can't afford to accommodate visitors right now. I don't tell you all this just to scare you. I tell you this to save your life. We all have to own our actions right now, all of us. Ultimately, you'll be judged by what you do in this moment. And I have one job and one job only: to save as many lives as possible, to keep as many people healthy as possible until we can develop a treatment and a vaccine. So please, please follow instructions and stay at home.